Hello, and welcome to East Minute. I'm Lisa Kadadik, and this presentation will discuss alcohol-related trauma re-injury prevention with hospital-based screening in adult populations. This is an Eastern Association for the Surgery of Trauma, evidence-based systematic review. Unaddressed hazardous alcohol use among injured patients may result in recurrent injury or death. Many trauma centers incorporate alcohol screening, brief intervention, and referral to treatment, sometimes referred to as ESPERT, for injured patients with hazardous alcohol use. This is recommended by the American College of Surgeons Committee on Trauma since 2006. However, this recommendation was based on low-level data and expert opinion, and to our knowledge was not formulated based on a systematic review using grade methodology. For this reason, our group sought to perform an evidence-based review of literature evaluating the impact of hospital-based alcohol screening on outcomes of interest, including prevention of recurrent injury in adult trauma patients. We utilized grade methodology to evaluate the evidence and formulate recommendations. Our PICO question, noted here, shows that our population of interest was adult trauma patients. Intervention was any emergency department, trauma center, or hospital-based alcohol screening with brief intervention and referral to treatment for appropriate patients versus usual trauma care. Critical outcomes of interest were re-injury and hospital readmission, and important outcomes of interest, as voted on by our working group, was alcohol-related offenses and alcohol consumption. A research librarian assisted us with a systematic search of PubMed, Medline, and the Cochrane Library. We utilized no date restrictions. However, we did limit studies to those published in English and in the U.S. Our mesh search terms are as noted here. And our PRISMA flow diagram demonstrates our process whereby we initially identified 148 citations, reviewed abstracts for these, and narrowed those down to 14 full-text articles, which we reviewed for inclusion, and 11 were noted to be appropriate with regards to our PICO question. Summary of evidence is noted here, and I'll break these down for easier interpretation. The studies highlighted here did find evidence to support ESPERT versus usual trauma care in terms of significant decrease in alcohol consumption, alcohol hazardous use and abuse, and alcohol-related offenses, as well as a decrease in self-reported recurrent injuries. Studies highlighted here either showed no difference between the intervention and control groups, or there was only an intervention group with no controls. This group of studies highlights the fact that it is difficult to discern the impact of ESPERT versus no ESPERT, since sustaining an injury related to hazardous alcohol use in and of itself may be a confounder. It's entirely possible that the impact of the injury and hospitalization experience itself, regardless of ESPERT, leads to changes in hazardous drinking behaviors. Finally, the studies highlighted here were of low or very low quality and had significant risk of bias. Our recommendation, as voted on by our working group, is as follows. In adult trauma patients, we conditionally recommend emergency department, trauma center, or hospital-based alcohol screening with brief intervention and referral to treatment for appropriate patients. This recommendation is based on overall low-quality evidence, but recognizes large effect of intervention. Thank you.